Hi everyone. Have you ever noticed that it seems like psychologists, life coaches, mental health professionals, pop psychology seem to have a language of their own? How sometimes psychologists and other mental health professionals seem to be speaking a language in which you might understand what the individual words are, but that you don't really understand what exactly the person's talking about. We call this psychological jargon, and it's a big problem in psychology. Psychological jargon refers to the specialized language and terms used by psychologists and other mental health professionals in the field of psychology. The jargon includes words and phrases that may not make any sense or are unfamiliar to people who are outside of the field of psychology. Now, sometimes the psychological jargon refers to specific psychological concepts, theories, techniques, or phenomena. Sometimes this jargon includes terms that are well defined and well understood within the psychology community, but may not make sense or may not be familiar to people outside of the psychology community. Words like cognitive or psychotherapy, neurotransmitters, psychoanalysis, personality, cognitive dissonance, mindfulness, cognitive challenging, acceptance, and commitment. Now, while this jargon can be useful for professionals in the field to communicate with one another, it can be confusing or off-putting to those who aren't familiar with these types of terms. And I'll be honest, sometimes I fall into this trap, using terms or diagnoses that make sense to me, and I know exactly what they mean, I know exactly what I'm talking about, but they aren't necessarily well known and well understood by people who don't study psychology. So it's important for mental health professionals to be more aware of this and to try and explain things in plain, regular language when talking to clients or people in the public more generally. Now, there's also another set of psychological terms that I'll lump into this category of jargon, and these terms relate more to things that sound really good or sound like they are deep, important psychological concepts, but really don't mean anything and can leave people feeling really confused. This tends to occur more in the pop psychology field, where people try to bring psychological concepts into the mainstream, but in a way that's almost looking to make sound bites or terms that seem really meaningful and important, but it's just a bunch of fluffy air and psychobabble. Things like, it's important to reconnect with your emotions, or you need to feel your feelings, or give yourself permission to feel your feelings. Becoming more in tune with your emotions, and engaging with your experience with intentionality. Holding space for something or someone. Now, I'm not saying that these terms may not mean something for the people who use them, but for a lot of people, these terms just don't make any sense. How exactly am I supposed to feel my feelings? What does that even mean? So, like I said, psychological jargon is a problem in psychology, and I think it's one of the reasons why people sometimes get turned off by psychologists and mental health professionals, because we tend to use a lot of jargony terms. And there are a lot of problems that come with psychological jargon. The first of which is confusion. Jargon can lead to confusion because it's like a specialized language that isn't familiar to everyone. When a person's using jargon, it's like they assume that the person they're speaking with understands the meaning of the terms that they're using. But if the listener isn't familiar with the jargon, they may have no understanding and no clue what's being said, which can make it really difficult to follow along with the conversation or to understand any information that's being talked about. So for example, I'll often use the term cognitive behavioral therapy, and for people who've never heard that term before, they may not have any idea of what cognitive behavioral therapy means. The person may not know what cognitive means and have difficulty understanding the conversation or what exactly the treatment entails. So That's why I spend a lot of time when working with my clients, explaining and providing a rationale about the principles of cognitive behavioral therapy to make sure that the person knows what I mean when I talk about CBT or cognitive behavioral therapy. The other way that jargon can lead to confusion is because sometimes jargon is used in inconsistent ways. Different professionals or researchers may use the same term to mean slightly different things, which can lead to confusion in someone who isn't familiar with the different uses of the term. So for example, when we talk about trauma in the context of a disorder like post-traumatic stress disorder, that is very different than other traumatic experiences that people will experience in life, such as a job loss, a marital breakup, that sort of thing. Now, while those things can certainly be traumatic for the person who's experiencing them, and some clinicians may refer to those as traumatic events, those would not be considered trauma in the context of PTSD. Now, another problem with jargon is that it can lead to alienation because it can make people feel like they're on the outside looking in. When someone's using psychological jargon, they may be using words and phrases that are familiar to the people that they're speaking with, and this can make the listener feel like they're not part of the in-group that understands the specialized language or terms, and this can create a sense of exclusion or isolation. I sometimes see this in the field of neurofeedback, where neurofeedback clinicians will talk about all sorts of brainwave patterns, alpha brainwaves, beta brainwaves, and I'm a psychologist and I have no idea what that means. And so it really does make it feel like the person's talking to you in a completely foreign language. So if a mental health professional uses a lot of jargon with their client, the client may actually feel like they're not able to fully understand what's being said, and they're not able to fully participate in the conversation or therapy, which can lead to the client feeling frustrated or discouraged, and they may feel like they're not going to be able to benefit from therapy because they don't even understand what the heck this person's talking about. The jargon can also lead to alienation because it can create a sense of distance between the person who's talking and the person who's listening. It's almost like it creates a power dynamic in which the person who knows and understands the terms is talking down to the person who doesn't know and who doesn't understand the terms. Another big problem with jargon is that it leads to lack of clarity because jargon obscures the meaning of what's being said rather than clarifies it. So when someone is using psychological jargon, they're assuming that the person they're talking to understands the meaning of the terms that they're using. But if the listener doesn't understand the jargon, they may have no idea what's being said, and this can make it really difficult for clients to follow along with the conversation or understand the information that's being presented. For example, a term I'll often use is cognitive restructuring. If I were to use the term cognitive restructuring with a client who's never heard of it before, the client may have no idea what I'm talking about. They may not know what cognitive means or what restructuring means in the context. And as a result, they can have a hard time understanding what the heck we're actually talking about. Now, jargon can also lead to a misuse of language, particularly when psychological jargon is used in a way that isn't accurate or isn't appropriate. Some people may use jargon as a way of sounding more knowledgeable or to make themselves seem more important. Now look, we've probably all done this before, where you've used a term that seems really fancy, but you're not really sure exactly what it means, but you're hoping that you're using it in the right way so that other people will think that you're smart. Other times, though, people may use jargon in an attempt to intimidate or manipulate other people. The psychological jargon can be used in a way that's not only unhelpful and meaningless, but can actually create confusion and misunderstanding. One of the ways I've seen this is in people who use the term cognitive dissonance, but use it in a way that is not at all what cognitive dissonance means. And that leads to all sorts of problems and misunderstandings when I then have to clarify what cognitive dissonance is, and that what they're actually talking about is something else, like denial or avoidance of negative self-perceptions, that sort of thing. So psychological jargon can be problematic for a variety of reasons. And so as a psychologist, I try really hard to avoid or limit the amount of psychological jargon I use. And I try to do this in a variety of ways. First of all, it's important to know your audience. When I'm doing these YouTube videos, I need to be aware that the majority of people I'm talking to may not understand some of the terms that I'm using. And it's a much different situation than in a therapy session when my client can ask a clarifying question if they don't understand what I'm talking about. So whenever possible, I try to use plain language as much as I can to make it easier for others to understand what I'm saying and to avoid confusion or misunderstandings. Another way to avoid unnecessary psychological jargon is to be confident in what you know. And what I mean by this is that people often use jargon to impress other people, to sound smart, to sound like they really know what they're talking about. Whereas a person who is confident that they know what they're talking about, they don't have to use jargon to make it seem like they know what they're talking about because they're confident that they do. Another way to avoid jargon is to make sure that you're defining the terms that you're using for your listener. By defining cognitive, for example, I have a better sense that my clients will understand that what I mean is their thinking. And related to this, it's important to ask for feedback. If I'm not sure whether or not someone understands what I'm saying, I'll often check in with them to make sure that what I'm talking about makes sense to help avoid any confusion. So, I'll be honest. I can be guilty of using psychological jargon because sometimes it's just an easier and more efficient way of communicating psychological concepts. But the important thing for me to remind myself of is that it's actually not a more efficient way of communicating psychological concepts if people don't understand what the heck I'm talking about. So I hope that gives you a little bit of a better understanding of psychological jargon and some of the problems associated with it. And if you ever find yourself talking to someone who's using a lot of psychological jargon, ask them to explain what they're talking about in plain English and more understandable terms. If they can't, that's probably a good sign that they really don't have a clear sense of what they're actually talking about. And if you want to learn more about cognitive behavioral therapy, to understand the meaning of this very jargony term, then I encourage you to check out this video. So that's all for today's video. As always, thank you for making it all the way to the end of this video, and I will see you in the next one.